A lot of people might not know just the wide range of people in the MDT that looks after our patients. We've got OTs and physios, specialist nurses, as well as the doctors and nurses that look after our patients from pre-op all through to discharge.
One thing many people doesn't know about my job is that they think that we cuddle babies all day. Some days are so busy and the babies are so poorly we don't even get to handle them that much. I find the job very rewarding and I wouldn't dream of doing anything else.
The job that I do is very much focusing on community, in the community, in people's lives. You are very privileged to go into the homes as the health visiting and school nursing services.
Some things about nursing that people probably don't fully appreciate is I've had some really sad times as a nurse. The days when I supported a family whose child was dying. That child was the same age and gender as the child that I had at home. That was really quite hard.
I've recently been involved and responsible for the introduction and management of the nursing students on paid placements as part of the NHS emergency response to COVID-19.
I often work with children who have broken bones and limb length discrepancies. A lot of the children have metal frames on the outside of the legs, which involve a lot of care and taking after to help prevent infection. We also have children that are nursed on traction, and we also look after patients who have had spinal correction surgery.
In my role, I support researchers and the clinical research facility team to deliver research throughout the Trust. I provide training sessions in accordance with good clinical practice, such as informed consent, best practice and site file management.
We've recently had our business case accepted for laser Doppler. That will help in the assessment of the deeper burns and in turn prompting theatre and reducing the admission length and in turn it reducing the amount of cost spent and the whole experience really for the burns patients, not having to stay in hospital, being away from families, will reduce stress and anxieties for many. So that's really pioneering treatment moving forward.
My other service, which includes those young vulnerable people who have been sexually exploited, as well as those on the margins of society, such as substance abuse and other hidden harms. So I'm very privileged to be able to support my teens, who I'm very proud of, to undertake those very challenging areas of work.
One thing you don't know about my role probably is that I'm responsible for the quality assurance replacements for the Trust, and this means that I work closely with the feedback to Health Education England.
One thing people don't know about my job is that I actually spend a lot of my day at work looking after the parents and helping them learn how to look after their little ones when they're in the hospital with us, and so they can take them home one day.
But I've also had some amazing experiences as a nurse, and some of those have been when I've had the opportunity to travel to America and Australia to look at nursing models and the delivery of nursing care in those countries.